the administrator for Medicare and Medicaid, very important person when it comes to healthcare in the United States. Our friend Dr. Mehmet Oz is here. How are you?
I'm doing very, very well. Talking about the Dakotas here, by the way. But I know we have a bigger topic than that today.
We do, but we appreciate you very much, and you might even be coming sometime in the future.
Leader Thune has told me I'm coming, so I'm going, and I'm going to visit Senator Kramer, Hoven, a bunch of your colleagues. But I've also, for many, many years, wanted to go to Mount Rushmore. So I'm admitting right now I'm going to be a bit of a tourist as well.
Good for you. Just so you know, just to the north, in the Badlands of North Dakota, the Theodore Roosevelt Presidential Library is under construction, which is going to be an America 250 event, because believe it or not, he spent a lot of time in North Dakota. You'd love it there too, so you could do a twofer.
Well, I'm a massive fan of Teddy Roosevelt, the Bull Moose Party, which he started after leaving the Republican Party. In many ways, what he was speaking about is being acted on now. The concept that we are a strong nation and that powerful people have obligations to each other and to the environment, but do it the right way. Don't virtue signal. Go out there and actually make a difference, and I think he speaks to that in many of his actions, and they're reflected in the Badlands.
Last time I checked, pretty healthy guy after being born with some challenges. And what did he say, something about no better place to heal than on a horse?
That's exactly what he said. He was actually born in New York City as a sickly kid, went to Harvard, learned a lot about sports, and then just went out west and developed a tremendous affinity for our nation. And what it really, the rural areas, but also developed with the Rough Riders and others, this belief that there's a masculinity that has value. And it's not that it's a good or bad thing. Women and men both have masculine elements to them. But the masculinity that he represented was very much about the fact that you control your destiny. And so much of what we want to do in healthcare in America is give the power back to you. The MAHA movement is about empowering individuals to realize that they fight the battle for health in their living rooms, their kitchens, their bedrooms. They don't fight it in the hospital bay waiting to be seen by a doctor, although sometimes you got to do that.
So we're so glad you're there. First of all, you're a patriot. Obviously, you've leaned into this. You said, I'm going to run for office. Now you're obviously in the administration. That's no easy thing for a media personality and a great entrepreneur like yourself. So we do appreciate the fact you're doing what you're doing.
Well, you're kind to say that. I've always felt I was in the change business. And when I was a heart surgeon, full-time heart surgeon, I developed a lot of tools that we would use just because I thought we could do heart surgery more elegantly, less invasively, more effectively. Hosting the show, same thing. I try to focus on topics where if people knew what I knew, they'd probably act differently. And as an administrator of Medicare Medicaid, I can tell you without any question, if you knew, sitting at home listening right now or watching, what I know, you would act differently about your own health. There's a lot of things we spend money on where we don't get our money's worth. We're twice as expensive to take care of per capita as any other country in the world, but we're number three cause of death in America is a medical error. Right, so we don't actually feel healthier as a country, even though we're investing top dollar to get there. And if we can improve along the lines of what the MAHA movement has been arguing, but I think many folks around the country have felt deeply in their soul was important for us to respect the soul, the temple of the soul, and to allow ourselves to be as healthy as possible so we can truly live fully. It's a much better life, but you cost the country a lot less money too, which allows our healthcare funds to go much further.
Not sure I can remember ever any person in government referring to the temple of the soul. But if you don't start there, everything else is for naught.
Well, it's a gift you're given by God. It's a precious entity, and you abuse it. And I feel badly when I see it happening. People, they'll do things like smoke, or they'll eat more than they should. They put weight on, and I look at the images, and when I operate on them, I open their chest. You can see the fat layering around their heart. No one wants to do that to their body. It's a precious entity that you're gifted with. It's the most valuable thing your parents ever gave you was your body, and hopefully the health that goes along with it. And we abuse that, and ultimately expect the healthcare system to pay to fix it, which of course costs a lot of money. I think part of the reason that it's so expensive to get healthcare in America, and there's a bunch of things the president has been doing to try to fix these issues, but part of it we got to do ourselves. Which, when you're overweight, and 43% of us are, that's twice the number that's in Europe. 10 times more than in Asia. But when you're overweight, everything's more expensive. And you got to have things done that you normally wouldn't have had done. You don't need to have heart surgery oftentimes if you're not overweight. You don't have as many strokes. You don't develop cancer as often. Lots of clinical conditions rise up when you're overweight.
I have a host of gut issues. First ulcerative colitis, later my colon out. And I find something very interesting. I've been to Norway a few times. I go to Norway in a week. I feel like a different person, right? I mean, and by the way, speaking of obese, you see nobody who's obese, but I come back and it's right back into it. Why is that happening?
We believe that because they process food differently in America than they do in Europe, that we're introducing elements that are experimental. In fact, this is part of Secretary Kennedy's big push, and the President has agreed with it, that we have this concept of generally recognized as safe. Well, that doesn't mean it's safe. It means that no one's bothered checking. And it's a loophole that a lot of folks run through, and some companies have taken liberties with how they process our food. It's not so much how we grow it even. It's what we do to it after we've harvested it out of the land. So what I tell my friends is eat food that comes out of the ground looking the way it looks when you eat it. That's real food, whole food. If you eat real food, by the way, that means butter and fats are okay.
Beef tallow, baby.
Beef tallow, yes. Eat real food. Some steaks. We have a ranch in Okeechobee in Florida, and we have beef on, with cattle on the ranch. I mean, eat real food, and if you do that in moderation, you're going to be just fine. You'll stay at your playing weight. We'll all look like you, like a gazelle.
I want to talk to you a little bit about Medicare and Medicaid for our audience. Obviously, the two largest healthcare organizations on the planet. I have a brother-in-law who ran insurance companies for a lot of years. And he always talks about the inefficiencies of it and working together. And he asked me to ask you this. He said, would it be better for those two entities to merge to achieve, obviously, the economies of scale, improve pricing, more streamlined processes so the providers would have one set of rules to follow for both programs?
There's wisdom to that. The reason they're not merged in 1965, 60 years ago last month, when the entity was found, by the way, the first patient, Harry S. Truman.
Oh, goodness.
Even though Lyndon Johnson signed the law. But the reason it was separated was because it was felt to be a national obligation to take care of seniors. And so let Medicare do that for all of us together. But let's use the tools of states to do Medicaid, because states have different approaches to folks who are living in the shadows, who are having trouble, those the very young, the very old in particular. And so let states manage their vulnerable populations, and let's just support them at the federal level, but not take it over. And that was an important decision. I actually think it was a wise decision. What we have not done well is help states do a better job modernizing Medicaid. We pay the bills at the federal level, but as the big beautiful bill showed, sometimes it gets abused. And what happened during COVID was a wholesale abuse of Medicaid that put the program at risk. Now it's back on strong financial grounds. States can pay extra into the Medicaid program. The federal government will match them, but at least the incentives are aligned again.
Our governor said, give me 60% of the budget now, but give me more control. I don't need that 40%. Federal government can keep it and go to the deficit or the debt if you remove the strings. Can you be that nimble?
We can be that nimble, and states have the ability to ask for waivers. Waivers basically say, hey, listen, we know how to manage our people better than you do. Give me a certain amount of money and get out of my way. And so we try to do that. In this administration, particularly the president loves the private sector, but he also loves giving people autonomy. He wants to be aligned with the governors. So if the governors say to the president, we'd like this to happen, and it makes sense, then we're going to go along with it, and we have been. So the whole mechanism by which you make those changes is dependent on the leadership of the states. Some states have better leaders than others. I've met your governor, strong man, a strong person with great wisdom, but I think it's critical that we allow governors to talk to each other and find the best path forward, because not all governors are as passionate or understand health that well.
I want to talk a little bit about what you found when you walked in the door. You obviously come from the perspective of an actual provider, a doctor. You know this backwards and forwards. When you walked in, give me a sense of the monolith of what you were leading, and second of all, how quick that Titanic can shift.
The most surprising thing about entering government, and I realized this soon after entering the door, was that you have incredibly smart people who are mission aligned. But they have felt like there was a bit in their mouth pulling back. They were bleeding because they weren't able to rush forward and make a difference. And so there was almost a sense of relief that this president had a very clear agenda, what he wanted to do differently, and gave his anointed individuals, in my case for Medicare and Medicaid, the right to go out there and fight. Go out there and make the changes we think will benefit our nation. So it's a breath of fresh air. And I want to reemphasize that if anyone listening right now, the federal government has incredible human beings with remarkable talent. If you want to be part of the change that we're seeing, it's a generational opportunity. Come join us.
How many people were filling a seat, working from home, fighting against everything you care about?
There were enough of the people you described, but there are not many left. We ended up, Bobby Kennedy took about 20% of the workforce down. We eliminated agencies we did not think were helpful. The folks who have remained have been fantastic, and now we're back in a growth phase. Now we're done the hard part, the pruning. We have mission-oriented people, and we're trying to put more staff to support them so we can continue to grow. I'm very proud of them.
You have a supportive Congress now. We know at least certainty tells us that'll happen through, the midterm election. You have 2 more years in the administration. What's your big vision? How quick can this move, the transformation on all of this change you're implementing?
One thing I've learned, and the president taught me this, is the power to convene is an incredible one if you use it correctly. So listen, I can get laws passed, take a long time. The One Big Beautiful Bill was a very ambitious law, but it took a ton of effort. You can't do that a lot. You have rules you can make if you're an administrator like I am, but those rules take time also, and oftentimes they can be clumsy. They're not as nimble as if industry does it themselves. So one thing I've learned from your senators is you can regulate by spanking people or you can regulate by teaching people. We're trying to teach. We're going out to different sectors of the American economy, insurance executives, hospital executives, doctors, groups, etc., and say, listen, you guys can, in a more nimble way than we can, make your entity work better. Do it. We're not getting in your way, but we're going to monitor it. If it doesn't work out the way it should work for the American people, we're going to come after you. But if you can do it right, then we're going to allow you to run your businesses more effectively than historically possible. We'll make it easy for you to do the right thing.
Can more be done with insurance companies in tax policy related to prevention and wellness? And how do you, again, take that on? Much of that in the private sector. Government can suggest, but where's your leverage there?
We have definite leverage, and this is the Maha movement. Listen, I'm not going to teach you or tell you what to put in your mouth, but we can pay for processes that encourage prevention. And insurance companies have this right now with Medicare Advantage, where they can actually pay for certain activities that they believe will prevent illness. Medicare has that tool now. We're trying to do it in Medicaid, but across the board, it's the same basic reality. It is your patriotic duty to take care of yourself. I'll say that again, it's critical. It's your patriotic duty to take care of yourselves. We cannot afford to take care of people who are trying to get sick. So if we incentivize every payer and every provider and everyone involved invested in the healthcare system to focus on prevention, that's where the money goes, that's where the focus will go.
There has been some controversy recently related to some of the ag community that I know well, that what Secretary Kennedy is doing is going to be detrimental to production agriculture and feeding the world. Concerns over obviously the applications of weed control and other things that help those products grow. What would you say to growers that are concerned to big agriculture, for lack of a better term, which we have a lot of in the Dakotas and Montana and Minnesota? Would you comfort them with some words about that and how this will work together?
I'm very close to Secretary Kennedy. We're close personal friends. We all vacation together, but I also work next to him. You're not going to find a more curious person who respects the role of agriculture in America, nor even someone who appreciates and reveres the rural parts of our nation. And whatever little bit he doesn't know, Brooke Rollins is teaching us, so Secretary of Agriculture. So you have strong advocates within the government. The president is not going to do things that hurt agriculture either. Our belief is that we can help farmers do an even better job by providing additional tools, at the same time addressing concerns about how Americans are consuming calories. And a lot of it's the processing that happens after the harvest. So it's that holistic approach that moves the needle for us. If you get moms who love their kids more than anybody to understand the fallacy that processed food, which extends shelf life but shortens human life, is a shortcut, is not. Is a shortcut to a problem. And I think those are where that's where the attention ought to be placed.
I want to ask you a little bit about hyperbaric oxygen treatment. We have a world-class clinic in North Dakota. Lee Swanson, Eastone Swanson Health Products, vitamins all over the globe, started a foundation, not to make money, but to help people with hyperbaric oxygen treatment. Senator Kramer, who you mentioned earlier, has been a huge advocate of getting the VA to use this treatment for PTSD and for traumatic brain injury. But these people fight a battle unlike anything I've seen every day, because insurance companies will say maybe a little bit of this. The medical providers look down their nose at it. I mean, they're literally dealing with crumbs from everybody. What can be done to transform that?
What we learn about in medical school affects our behavior for the rest of our careers. And I say that because most people would acknowledge this. If you don't learn it in your schooling, you probably don't think much of it. And we actually think as doctors, if we didn't learn it, it probably is not that important. Because if it was important, they would have taught it to us. Hyperbaric oxygen therapy really didn't have any kind of a presence when I was going through my training. I have personally, out of interest, learned a lot about it. There's a great group in Orlando, the Aviv Center. It came from an Israeli program initially. There's others around the country that have been quite effective. I do think hyperbaric oxygen therapy could be beneficial for brain trauma, for maybe even dementia, we don't know, but we just need to get more data. And as companies get more sophisticated in analyzing and offering what they're providing, we're going to get that information. You're going to see it offered more robustly. That stated, you also don't want to overpromise, and so that's the challenge of any new technology. And at Medicare, Medicaid, my job is to protect your tax dollars, but use it for the betterment of your fellow man. And so that's the dance that we're going through. And a lot of the ideas that we're pursuing now, especially around devices and things like hyperbaric oxygen, we take that pledge. We're going to streamline it. If it works, move it as fast as possible, but be tough in our adjudication to make sure it really is delivering what's promised. Because not everybody with PTSD is going to benefit from hyperbaric. Pick the ones that's going to help, get them into the program. You move on with other therapies for folks whose conditions may be different.
When you talk about the data and when to use it, don't overpromise, explain the science behind it. Really, you're just getting a lot of oxygen into the body. So there's, other than safety issues, which our clinics are super hyper careful about, there's really no harm in this for anything to try it, is there?
Well, I'm not concerned about the harm side. I'm concerned that there may be conditions that are problematic that aren't caused by lack of oxygen. Not all pathology in the body is caused by inadequate oxygen supply. There are some conditions, like you mentioned post-traumatic stress disorder, or brain traumas have been better. With brain trauma, there's oftentimes an association with inadequate blood supply to the traumatized region, so it makes perfect sense. In other conditions, like in cancer, it's not a lack of oxygen, quite the opposite. Oftentimes in cancer, we're worried that the cancers are growing by providing themselves stealing oxygen from other parts of the body. So that's why it's an ecosystem. When you plant a garden, there's no right plant. You need the right plant for that garden. You need the right treatment for that problem.
Yeah, interesting. What would you suggest to providers related to data and the speed? It's unusual to me that there isn't more data available, because this goes back, I forget how many centuries, but obviously the bends have been a problem for a long time. So it's not a new technology, but obviously we are where we are. How can they put that on steroids to get the data you're asking for?
Well, sometimes they're not asking the right questions. And sometimes when we do ask the right questions, the data is hard to get. It's not that easily translatable. But one thing I'll give you hope for, even above and beyond hyperbaric oxygen, is we now have data interoperability in medicine, which means, in English, that we are forcing hospitals and doctors to share health information about their patients, if the patient wants it, with the rest of the ecosystem. So again, if I'm getting care from you and I want to have my medical records used by an app to give me better advice on how to deal with my depression that I'm suffering from, or my weight, then I'm allowed to authorize that to the system. Historically, that never happened. And it's wrong, because you own your data. You own your medical data. You paid for it, it's on your body, it's yours to give away or not. And so if you want to give it away to somebody, you should have the right to do it. And if you don't, it should be securely protected. That's changing now. So imagine all the patients who ever had hyperbaric treatment for their brain being able to exchange their medical data. All of a sudden, you've got a lot of real world information that can be used for other providers, but also insurance companies, which is what Medicare and Medicaid do, to decide to reimburse.
A couple of the quick topics related to the One Big Beautiful Bill and the changes. There is a enterprise in this town of what some would call the swamp, others would call the regime media and their alliance, to just give you an onslaught of attacks. And that certainly came related to the Medicaid situation within the One Big Beautiful Bill, that the administration was kicking people off of Medicare and that people would die. I mean, they just jumped the shark right to the craziest stuff. What will the facts show once all of that is rolled out related to those services?
President Trump saved Medicare and Medicaid. Medicare, we didn't touch at all. He's saving it by putting in rules that will allow it to be delivering care to more people for longer. With Medicaid, he had to push for some important changes so that we could remove the fraud, waste, and abuse. And Leader Thune and Speaker Johnson, and the Senate and House, they came ready for war, because they knew we did not have an opportunity in the future to do this again. We had to get it right this time. There's one opportunity to take the fraud, waste, and abuse out of Medicaid. If you don't do that, the system will eat itself, and you will not have a program to take care of those who are most vulnerable. And listen, we're a great country. We're going to take care of people who've slipped and need help getting back up again. And Medicaid now can do that again by taking away some of these money, basically, it was legal money laundering. that was taking place, all stuff that happened during COVID, by the way. This wasn't the case 5 years ago. We just took the programs back to the way they were designed. The one big change we added was the work requirement, because most Americans rightly believe that you should not be sitting at home watching TV or just hanging out for 6.1 hours a day, which is the number, by the way, for able-bodied individuals on Medicaid. The program wasn't designed for that. 60 years ago this month, when it was created, it was designed for those living in the shadows, people having trouble, the twilight of their life, the dawn of their life, children, elderly, folks who have chronic medical illnesses. Getting able-bodied people to know and believe and feel like they matter by going back to work or getting educated or volunteering for their communities, it's a wonderful gift to the entire country. This country needs to work. It has always worked. We're not going to create these programs that codify, that trap people in poverty.
Talk about the guardrails and the implementation of the work requirements. One thing I think has gotten lost is it's not like you're ripping this away and say, you're able-bodied, go work. I mean, there are provisions, there's all kinds of things, obviously families and whatnot, but talk about what you want people to know related to those work provisions and when there is built-in empathy, for lack of a better word.
The argument made by our political opponents is that the program is designed to try to trick people to fall off Medicaid, but not the case. In fact, we're investing a lot, and we already started with 2 pilot programs that worked successfully in Louisiana and Arizona to allow you on your phone to tell us where you work, and we will do all the rest of the work. If you just let us ask your employer how much you work, can you get an education? We'll hook you up. You get a job somewhere else, we'll add that to your list. Can you volunteer? Can you show us that you're taking care of family? All that counts. And then if you do that stuff once every 6 months, then you have Medicaid. Free health insurance, worth a lot of money. It's all yours if you just let us know what you're doing and make sure you're a U.S. citizen and that you're supposed to be on the program. There's the kinds of things they're common sense. It's surprising to me there's so much frustration about it until you realize, as you point out, that it's really about politics. People just trying to score points. They know deep in their heart someone had to make this important decision. The president was brave enough to push for it, and the House and Senate were wise enough to pass the legislation. We will be graded rightly and appropriately with positive notes for this move.
You sort of go back to where we started, but you couldn't do what you just described, those pilot programs or anything else you're implementing without a wicked good staff, because a lot's happening fast, isn't it?
It's one thing I've learned from the president is move quickly because they're trying to catch you. So just keep moving with the agenda. Don't get slowed down by people who are biting at your heels, yelping, because they're not really interested oftentimes in, listen, once in a while someone's got a good point, you want to address that, address it, but a lot of this chitter-chatter you hear, it's gossip. The brave moves that require movement. And you talked about Teddy Roosevelt earlier. He would always gripe about people outside the ring talking about the boxers in the ring. Right now we're in the ring. We don't have the luxury of commentary. Just go fight the battle, win the war.
In the arena.
In the arena.
That's amazing. Last question I ask for you. Tell our listeners about President Trump and what you've seen up close.
I'll tell you a personal story that I haven't shared much. I had my oath of office in the Oval Office. And we were all there, my whole family was there, Secretary Kennedy, and right at the end of it, there was a press conference, and it was going a little bit long, and one of my grandchildren fainted. She, a little 11-year-old waif, hadn't eaten breakfast that morning, collapsed. So they whisk her off to the president's private area, they get her, better. Meanwhile, the president sees my grandson, like a moose, running around the Oval Office, angry that his sister is sick and worried about her. He calls her over, and I point this out because this is who the man really is. He says, come on over here, little John, sit on my lap. So this is the Resolute desk. Look through this, any drawer you want, pick what you want. So John opens the center door, there's a huge presidential coin in there. President says, it's yours. I promise you it's yours. And then he asked a question that I'll never forget. He looked at John and said, your sister was sort of sick there. And John was upset about that, but he was feeling better with the coin in his hand. And so the president said, what are you going to give your sister? And he looked at the coin, John, looked at the president, looked at the coin. He says, I'm going to give this coin to my sister. That's the kind of man the president is. He gave him a gift, gave him a lift up, and then made him think about his obligation to the rest of us. By the way, when his sister, my granddaughter, came back, she didn't want the coin, she wanted his pens. She grabbed all the official White House pens.
Everybody was happy.
Everybody was happy. The president makes people happy. He's a grandfather, he's a father, and he's a wonderful leader.
As you are, in an important topic, Dr. Oz, thank you so much for your service to this great country.
God bless you.